we've been telling you about Bronson video visits. There are four options, and we're going to find out about some of those right now with Denise Bartz, Director of Practice Operations for Bronson Medical Group. Denise, good morning.
Good morning, Tim. It's great to be here.
It is great to have you on. A very timely topic and something that, you were telling me during the commercial, a lot of people have taken advantage of in the last couple of weeks.
That's absolutely correct.
How many would you say in the last month?
Well, Tim, for our scheduled video visits, we have scheduled over 10,000 video visits. It's been a great way for our doctors to stay connected to their patients during the COVID-19 pandemic that we're experiencing.
Well, and it sounds like a self-explanatory term, but I should ask you, what is a video visit, just so we all realize what we're talking about?
Sure. A video visit is a way that you can connect face-to-face with your doctor or healthcare provider from your home, work, or really anywhere you have internet connection. You just need a smartphone, a tablet, or a computer.
Excellent. And so how does the video visit work then?
Sure. A patient would access their video visit by going to the Bronson website or downloading a Bronson app to begin their visit. Once they connect, the patient answers some registration and some medical questions, and then they are connected to their doctor online. Once the visit begins, the doctor asks them questions, they'll perform an exam, and they're offered treatment options just like an in-person visit.
And some people are thinking, well, how can you really diagnose or treat somebody without seeing them in person? I mean, they whack your knee and you kick and stuff. But, I mean, there's a lot they can do, right?
Yeah, these are real visits. The doctor or provider has the patient act as their virtual hands to check swollen glands, tender, sensitive areas on the body, or check their pulse. They use the camera to look at the patient's throat and eyes. There are some limitations, though. For example, we can't treat ear infections since we can't see inside the ear. If the doctor can't diagnose or treat the patient via a video visit, they refer them back to the appropriate facility or come back into the office for an in-person visit.
But basically, there's a lot you can do and just probably a few things that you can. And the video visit is a way to find that out right away.
Absolutely. It's a way to connect to your doctor to really evaluate what your needs are.
Tell us about the four different types of video visit options at Bronson.
Sure, we have scheduled video visits, immediate care video visits, and we have two options for behavioral health. Our Bronson MyChart video visits allows patients to see their own Bronson primary care provider or a Bronson specialist via video. They're scheduled by a Bronson practice. And these are the ones where I talked about where we have scheduled thousands of since March, so our providers can stay connected to their patients. We also offer Bronson Connect immediate care video visits. These are for anyone in the community who needs care for minor health concerns. They don't need an appointment. You can access care day or night, 365 days a year. Due to COVID-19, Bronson is currently offering these visits at a discounted rate of $20 per visit. A patient simply enters the code 2020 when they register for the visit. And we have two options for behavioral health. We have Bronson Connect video visits for counseling. These are for anyone in the community who wants to talk to a counselor about anxiety, depression, stress, trouble sleeping. People can schedule these visits, in the convenience and privacy of their own home. The Bronson Connect visits for psychiatry, very similar to counseling, except they're offered by a psychiatrist who's a medical doctor and treats psychiatric symptoms.
Now, what if these video visits aren't my thing? I'm thinking of my dad. Probably not going to want to do this. Or if you have something that needs to be diagnosed or treated in person, is it even safe to go to the doctor or to the hospital right now? Are you fully operational?
Sure, that's a really great question, Tim. We know that many people are being cautious right now, and they really should be. The safety of our patients, employees, and community is our number one priority. Bronson has taken all necessary precautions, and we want our patients and the community to know that it's absolutely safe for you to receive care here at Bronson. We have limited some of our services. However, we are seeing patients throughout all of our locations, with the exception of Bronson Fast Care.
Now, there was a news story where some people are worried that people who might have like some heart concerns or shortness of breath or, even maybe stroke symptoms are reluctant to go to the hospital. Is video visit an option to kind of find out if they need immediate care?
Yeah, I mean, absolutely. We encourage people to call their doctor's office. We also have a Bronson Care Advisor team made up of nurses that are available 24/7, so they can assist you in getting to the right care as well.
Tell us where we can go to find more information, get the ball rolling on Bronson Video Visit.
Sure. Any information that somebody would need regarding video visits or a service, I recommend they go to our website, bronsonhealth.com, or go ahead and call one of our Bronson Care Advisors. You can reach them at 341-7788.
341-7788. Well, Denise Bartz, Director of Practice Operations for Bronson Medical Group, thanks so much for joining us today about Bronson Video Visit.
Thanks so much, Tim. Have a great day.
Yep, you too.